Hi everyone, welcome to Research MD. This is Dr. Pramil. Welcome to our channel. Um, just introduce myself first. Again, this is Dr. Pramil. I work as a Chief Medical Officer in the United States right here. That's where I am. Also an Associate Professor of Medicine. So today we're going to continue. A lot of times when the patient go to get the blood drawn for the lab, there's a lot of confusion. And if you don't do some of the things can affect your lab work. That's the whole purpose of this talk. Today we're going to talk about your doctor ordered CBC, which we call complete blood count. What kind of thing you should be prepared for before you go and draw the blood work. Okay. If you don't follow some of the guidelines, what's going to happen? You just kind of walk in, get the blood, and there's some abnormality of the lab can affect your treatment and give you a lot of headache. All right. So let's see, the doctor ordered, gave you the slip, you need to do a CBC, complete blood count. The first question, should I drink plenty of water? Be careful, not too much water. When you drink like a lot of water, what happens? Your blood get diluted. So your hemoglobin, the normal may be like 12, and if you drink plenty of water, what's going to happen is it can come down to 10, and you think that's you have an anemia problem. Okay, so drink whatever you do normally. You should. You don't want to you want whatever you moderate to drink. You should continue. Okay. The second thing is, should I fast for this test? I would not recommend fasting. The reason for that, when you fast, what happens? You get dehydrated, right? And then what happened is your blood become concentrated and your hemoglobin level can go up. Now, can I drink alcohol? Not really. What happens is when you drink alcohol, you pee a lot, you can get dehydrated, so your hemoglobin get concentrated, you get a falsely elevated hemoglobin, okay? And the same thing when you're like a chronic smoker and smoking, the WBC count can be elevated. Now, the next question, I'm taking steroids. Can I should I stop it, or what does it the effect on the blood count? Steroid can increase your WBC count. We call leukocytosis. Okay, so always remember that. So, but we're not recommending, if any of you are on any of this medication, please do not stop. Always talk to the doctor first. But I just, the whole purpose of this talk is to let you know steroids can affect your WBC count. Now let's look at the medication. What are the medication? We talk about corticosteroid. Let's say if you're on chemotherapy drug, that can decrease your, that can suppress your bone marrow, and some of the lab work can go down, especially hemoglobin, WBC, and platelet. If you're a blood thinner, it can affect the platelet. Iron supplement can improve your hemoglobin. Vitamin B12, folate also can affect. If you're an antibiotic, and it can have also, you can lower your WBC. And anti-epileptics can decrease your platelets, or it can decrease your WBC. So remember that. If you're on any of this drug for medical reasons, check with your doctor, but I don't recommend changing anything, but you should know that. What happens if you have a cold? Please do not go. If you have a cold, what's going to happen? Your WBC count is elevated. You might not be drinking enough, and you might have a leukocytosis, and that's like a lot of headache. Just get the cold, wait for it to get better. I would wait at least 1 week, and then before you go to the lab test, okay? What happened if I have like nausea, vomiting, or previously? Don't go. Again, it can affect the blood. You can hemoconcentrated, okay? Again, recent illness, infections, just wait until everything cleared. 1 week later, you get your CBC. Extreme physical activity, don't do any of that. That can also affect your blood count. Okay? And now, if I'm smoking, like a lot of people smoking like marijuana, and if you have cocaine, I would stay away from both of them, because that can affect your blood count. CBC will be affected. You can have leukocytosis, and chronic marijuana users, like what happens is like they become hypoxic, so bodies start producing a lot more hemoglobin to supply the heart and all that. So you have to be careful. So if you're marijuana, and or even cocaine can increase WBC. So don't do any of this blood. So any of this extra drugs like cocaine, you should stay away from it. So thank you so much for watching the presentation. We'll be making more videos like other lab tests also. Please subscribe and share. It's very, very important, your support. Thank you. God bless.